Good afternoon, ladies and gentlemen. Just make sure I can. You want to help me with this technology just to make sure that I. Oh, okay, fine. It's all right. I've got it. All right. Yes, again, good afternoon. And it gives me great pleasure to have this opportunity to speak about the Bridge of Hope to you, a business group, because when the developers of this home got involved with it, it was a very destitute situation, and none of us knew anything about leading and managing a children's home. I think the first big message that was clear to us is that we needed executive leadership. And that leadership, as the brief said just now, and narrated by Mr. Subesh Ramcharitar, was the person. Mr. Ramcharitar and his wife, Debbie, committed themselves not just to understanding what had to be done, but they took ownership of this initiative. And they took clear responsibility. They were prepared to account. They were prepared to account to a board. And they were prepared to account to a number of other supporters of the home, people like Field, people like United Way, people like Republic Bank, the Guardian Holdings Group, and many others like that they were prepared to account to. So I think that's the first very big issue that we dealt with. The clear need for a leader who will take ownership, responsibility, and account. The second thing, we were all really business people, not involved significantly in non-government organizations. When I say not involved directly in the operations, but involved, as most people are, probably contributing, whether it's meals, funds, etc. And we had to determine how to start, how to go forward, and we obviously then relied on what were our strengths, and that was we were all in business in some form or the other, and we decided that we would use best practices from business to this children's home. I think another very significant factor is that we were all, the few people who started the initiative, at one in our commitment to make a contribution. We also recognize that we would not have been able to do anything by ourselves. As a small group, yes, we could initiate. Yes, we can have a leader. Yes, we can govern. But we would require substantial help from a lot of people. And I think today we are able to say that those principles, those approaches we took bore fruit, and I will talk about the achievements later on. It's interesting to know where we started. We started in 1998 when the then operators, owners, if you want to say, of this children's home wrote to the then Minister of Social Development to say that they would not be able to continue to support these children. So we had about 25, 30 children at the home, and this, I say church in inverted commas, it was a church, writing to say that we can't handle these children, and government at the time also indicating an inability to help. So that's where we formulated the team, we started to work, and as I say, we took a very defined and determined approach. I would say a very visionary and strategic approach to how we would develop this home. So we obviously started, there was a quick fix that was required. We had to get funds to support the home over a short period of time, you know, the first couple of months, regardless of whatever we thought we would create. And that was done. But some of the challenges that we had to face were, we're talking about abandoned children. There's no fallback position that they would have had. The only fallback would have been, well, they've gone on to the streets, I suppose. We had a physical facility that was quite dilapidated and falling apart, and really no resources to sustain the home, to sustain the children on a daily basis. And as I say, at the time, there was no national organization that we were able to turn to say, can you step in and help and guide us on what should be done in a situation like this? This is not the first children's home, there are many others. Can somebody come in and guide us? There was nothing like that, and government also could not provide any guidance. And as I say, we're talking about leaders who, although involved in business, knew nothing about leading and managing and operating a children's home. So we're all novices in this game. As I indicated earlier, we decided to fall back on our strengths and bring proven business principles and methods to this home. Very early on, we started to determine, it was easy to assess where we are, which we did. It was a little bit more difficult to determine really where we want to take this home, what we want it to be, etc. But very early on, we decided we would define very clearly the sort of home that we would like to create in the future, and therefore we did formulate a vision that explicitly said to us what we are striving to achieve. And we formulated a high-level strategy and a plan of how we will start to pursue this particular vision. I'm happy to say that after these many years, we have largely attained many of the goals that we had set for ourselves. And a significant part of that was building the networks, the partnerships with a whole range of people, with individuals, with corporations, with other NGOs, with multilaterals, because along the way, multilaterals like the Inter-American Development Bank, we built relationships with embassies, for example, the Australian embassy and others, the American embassy. So it was quite wide-ranging, the networks that we constructed. Very early in the game, we brought in Field, and their directors came and visited and observed how we were approaching this initiative. And early on, were prepared to lend some support. That early support was really helping to tide over in the early days of the development of the home. So I think a huge message, and I think the principles used here are applicable to an NGO movement as we have been working with, or with business, being very clear about your leader, being very clear about where you are, where you want to be, how you're going to get there, what the detailed operating plans are, and all who might be able to help along the way. And we defined that very clearly. We were also very focused on why we were there. We were there because of the children. And as we formulated the vision and the way forward, we had the children also involved in this exercise. And I'm speaking of children 8, 9 years and even younger who participated. We also identify some basic values of transparency, of accountability, because we recognize that we recognized we needed help. And whoever was going to give us help, we had to account to them. We had to be very clear about all that we were doing with their resources, and that they should have been able to come and see at any given point in time what we were doing. So we had a practice of engaging and bringing to our home the people who were lending support. And it is a fact that, in fact, most people are quite happy to actually write a check to support an initiative of the type that we were doing, but however, not as willing to actually just pay a visit. That was a challenge in itself. So we had to use ways and means of cajoling and encouraging people to come and see. The great thing was, once they came and saw, that was it. They were totally hooked. And we learned from that and built on that and built systems around ensuring that our partners were visiting and seeing firsthand what we were doing. And I think that's probably a good principle in business also, to share with customers, suppliers, precisely what you're doing for them. Let them see what processes you have, etc. I suppose it certainly worked for us. Our vision, as stated here, back then was to be a model children's home. I think today, many parties, whether it's government, multilaterals, other NGOs around the world have come and acknowledged what we have done, and supporters have acknowledged, and hence the reason for the level of success, I believe, for the home. And it's, as the vision says, known for being the best child care provider. We are assessed all the time by parties outside of Trinidad also. We have had universities from outside of Trinidad, as far away as New Zealand, come and work with us, review what we're doing, compare us to other homes and institutions they have seen abroad, have worked with us in conducting surveys in the community around the home to understand the needs of the community, all of which contributed to us building the services and support systems to satisfy the needs as we saw them. Because as our vision says, for the upliftment of standards of all other similar children's homes, and also to be a center for family life development and satellite outreach for proven effective programs which were provided to the communities in which we operated. Our mission to bridge the needs to opportunities for at-risk individuals, families, organizations, and communities that want partnering using approaches that provide a non-threatening environment, cater to real needs, build life skills, develop local change agents, and promote stakeholders to own the vision and contribute charitably. And I think we are fortunate today to say that we're well on track in respect to those areas. We are on track to the extent that we have been able to convince institutions like BP, like Geneva, another international institution that operated here, and a couple other international institutions and local ones, who came together with us when they saw the results of what we did at the Bridge of Hope, to build what is called a community resource center in Kernahan village in Manzalina. And if anyone knows that community, it's a very poor community. And today, we have an early childhood center, early childhood care and education center, supported by institutions like BP and others, and operated by the Bridge of Hope. This was a very interesting experience for us when we extended and tried to help this community. We built this community resource center with the child care and education center, but the parents weren't prepared to send their children to school. It was that type of community. So that was a program we had not envisaged. We thought, having created a nice product, everybody would come and buy, and it wasn't like that at all. We had to, in fact, do the marketing and selling to the parents and community to convince them to bring their children to the school. Today, the school is pretty much fully occupied. And we have been sharing this model with a whole range of children's homes in the country. And one of the things we seek to do as we share our model with our other children's home, we try to apply some of the same principles that we applied and achieved success. For example, when we go out, we seek to understand who is the leader. The leader, a singular, the leader. Who is the leader of this institution before we go to the broad-based leadership? And we stick on that to pin that down first before we look at the leadership or the board, or etc., and other supporters. And we've found that that is singularly the most critical success factor. If you can get the leader and a leader committed, then we can work with that institution and make transformation take place and make whatever happens if we have that good leader to start. Because the rest of the leadership, we have found we can always construct. But without the leader, it's very difficult. I suppose that applies in business also. We have a whole range of community support services that we provide in the northeast of Trinidad. So all the way Toco, Matlot, coming down to Sangre Grande, and then across to Manzanilla area, Plomita, Biche. That broad community we seek to service and support. This is the most needy, obviously, in those areas. One of the achievements, interestingly, as a children's home, we have always been testing ourselves. You know, why do we have this home? What are we trying to do on behalf of these children? So maybe it was an academic exercise that we started at a point in time. What vision do we really have for the children, specifically the children, and not just the children home and everything else that goes with it, specifically the children? And we assembled a bunch of people, and we were fortunate, international people, some doctorates from Oxford and a couple other places, and we sat down and defined this vision for children. Because we wanted to be very clear of what we wanted to do for our children. But having completed this exercise, we suddenly realized, well, what about the vision for the children of Trinidad and Tobago? How has that been defined for the children of Trinidad and Tobago? So we entered some discussions with the Minister of Education at the time. And because of not being able to get something precise from the discussions, I was asked to come into the ministry and, make your own inquiries and see what you can find. Having not found anything, it was interesting what happened, that vision actually became the matter for discussion within the ministry, and today is actually the national policy in terms of the vision for children. So when you sometimes may hear the Minister of Education speaking about the vision for our children, it is that very vision that was actually developed out of Bridge of Hope. I think I mentioned the issue of the Kernahan Community Center. One of the things that we also discovered along the way, because of the nature of children who would be in our home, it was necessary to have a range of professional support services, psychiatric help, psychologists involved, etc., etc. And for many years, we used that type of service to help us understand our children, to know how best to provide services to help them in their development. And to be fair, those experiences really did not ever produce the right results, but we just didn't know what else to do until, and I can't really pin down how we figured this thing out or how we reached this party and found out about neurodevelopmental testing, and an institution from abroad, the United States, we connected with and started to test our children for learning and behavioral difficulties, and whether it's audio, visionary, etc. And this technology, if I can call it that was being used, we suddenly found that it was also very easy, because the specialist could come into the home, screen and test the children, and over 90% of the children could have been treated right at the home. They did not have to go anywhere else. And there was a remarkable improvement in these children, their disposition, their presence of person, their academic performance. In fact, schools in the Sangre Grande area were always reluctant to have the children from the home in the schools. And then suddenly, after our children went through this testing, screening, and treatment, and the results started to show, the schools themselves started to show great interest in our children. That form of testing, again, because we had now a connection with the Ministry of Education, we actually shared the type of results that we were having. And one would expect this level of difficulty amongst children in a children's home. In our children's home, we had almost 98% of the children, in other words, almost all the children, with some form of difficulty requiring help. The rule of thumb from the specialists who work with us believe that 30 to 40% of children in the community at large may have these difficulties, but we would not know about them. As parents, some of these difficulties are difficult to discern. So we started to talk to the Ministry of Education about testing children across the country. And today, it has been, the principle of this testing has been accepted, and government is expected to do a pilot test starting later this year in about 16 schools, 8 early childhood schools and 8 primary schools. So that's another contribution the Bridge of Hope has been able to make for itself, for other children's homes, and from a national perspective. Another significant factor is, having developed the vision for our children, we obviously saw it as an absolute essential that we define services and programs to satisfy that vision. And that's what we've been doing, and it has been working very well. And it's easy for me to stand here as chairman of the Bridge of Hope and say, yes, this is what we've been able to achieve. But I think the feedback we have had from parties from the outside have pretty much confirmed the quality of development of the children. And if one saw a little bit of the clip, I think, and if one visited the home, and I challenge all of you here to, it's a very, once you're heading towards Mayaro, Manzilina, it's right on the main road, so it's easy to just drop by and see what is being done. I think I pretty much covered the national contribution there, those points about the model, the the vision, the neurodevelopmental technology, introducing it at the national level. And also, we have been involved, particularly just recently, with helping the Children's Authority, the New Children Authority, to a lot of the systems, procedures, policies, and whatever we do are documented. So just as you in your business organization may have whether it's your vision, your strategy, your policies, your practices documented, we have ours documented. And therefore, it was very easy to share with other children's homes and to share with the government and the Children Authority in particular. In fact, we also formed an organization called the Children Villages Association of Trinidad and Tobago in partnership with FEEL, the sole mission of that organization being to take the model of the Bridge of Hope to other children's homes. We are leaving that now to the Children Authority. We're passing over all the information and results we've developed and hoping that the Children Authority will run with that particular ball. Just as an issue, really, and a challenge to us all here, we read all the time about children being abused and children being in difficult circumstances and children being murdered. And if one asks in our society, do we have an understanding of the children at risk in our society? The answer to that is no. And the reason I'm being kind of authoritative about it is that we at the Bridge of Hope, in trying to share our experiences and trying to do something about children, we're concerned about this problem, and we asked for help from the Inter-American Development Bank, and they provided the research support, the funding for the research support. So we have actually conducted the research in Trinidad. We looked at international institutions that may have done work in Trinidad to try to determine whether anybody, whether it's UNICEF, whether it's UNESCO, whether it's the Ministry of Social Development, whether it's CSO, or whoever else there are locally or regionally or internationally that may have done work in Trinidad to understand children at risk, and nobody has an understanding of children at risk in society. So when we talk, when a murder occurs of a child and it all flares up in the press and we get all excited, the question is, what are the preventative measures we are taking? And that starts with trying to understand who are the children at risk in our society. That has not been done to date, and I can tell you that just recently when not the present Minister of Children Affairs, but the immediate past, was appointed, we did go to that ministry and met with the permanent secretary and a delegation from the ministry and represented this issue as a major issue to be addressed. Whether anything is being done or will be done, I'm not sure, but I want to pose the challenge to you here, to all of us, I would say. Sorry. I don't know what has happened there, but I think I lost there. All it was that as we go about our daily business and we come across those who can influence an initiative like this, that I ask that you put some pressure on whoever you speak to encourage that an exercise, a survey be done in Trinidad and Tobago to understand children at risk in our society. I think if we could understand that, we will then probably be able to do something constructive about it. Otherwise, it's all shooting in the dark, hoping that a solution would hit the right problem and we'll get to wherever we want to get to. I don't think it's going to happen. It hasn't happened to date. So I'm just asking that each and every one of us could lend some support in our different spheres to encourage that survey of children at risk in the society. Thank you very much indeed for your time.